Hello, my name is Holly Welch, and I'm going to discuss one component of the Affordable Care Act and the American Health Care Act that I either support or do not support. I compared the Affordable Care Act to the American Health Care Act on the Kaiser Family Foundation website, and I found that the Affordable Care Act implemented the prohibition of annual and lifetime limits or caps on coverage. Prior to this component, the average policy had either a $2 million, with some having $1 million in an annual cap. And that basically meant that once that disease process had exhausted that, then the insurance didn't have to pay for it anymore. So according to the Associated Press in 2013, the cap limit of $1 million seems substantial enough to most insured at the time when they reviewed their insurance policy. But what insurance does is it masks the actual price of what health care costs. So most people don't understand that even though the $1 million cap was in place, that treatment that they paid $500 for may actually cost $150,000. So for clients or insured that had chronic conditions such as hemophilia, they could spend upwards of $200,000 on medications that prevented internal bleeding. So they had exhausted their cap limit for the hemophilia medication within about 5 years. And if that was their lifelong job of 30, 40, 50 years and they plan to retire, they've exhausted that cap long before they would have not had that insurance policy. So the Kaiser Family Foundation, when I compared the Affordable Care Act to the American Health Care Act, does say that the American Health Care Act is going to keep this provision of no annual or lifetime benefit caps as well. So I support that for both of them. A component I found of the American Health Care Act that I do not support is the Affordable Care Act has a 3-to-1 ratio for the price of insurance for older individuals. The American Health Care Act is going to change that ratio to a 5-to-1 ratio. So basically, a client or a person applying for insurance through the healthcare marketplace with the Affordable Care Act that's 30, somebody who's applying that's 55 or 60, they can only charge them 3 times more. With the American Health Care Act, they will be able to charge them upwards of 5 times more. So prior to the Affordable Care Act, we were penalized for pre-existing conditions when applying for insurance. The Affordable Care Act changed that, and insurers were not allowed to technically refuse coverage or deny them according to pre-existing conditions prior to coverage, but they can charge them more. So with the American Health Care Act, they're going to be able to charge them even more, 5 times more. So I understand that they still can't deny them coverage for pre-existing conditions, but in a way they still are, because they're going to be able to charge them 5 times more. And the American Health Care Act is also going to change the way that they subsidize the insurance. The Affordable Care Act has a subsidy to where it helps them pay for their insurance premiums. So American Health Care Act is going to change that, and it's basically just a tax credit. And that tax credit goes down goes up according to age and is based on income, kind of like the Affordable Care Act is now. But for somebody who's 30, the tax credit, let's say, is $1,000. It's more than that, but it's $1,000. And for somebody who's 60, it's only 2 times more than that. So they're only going to get up to a tax credit of 2-to-1 ratio, but their insurance is going to be a 5-to-1 possibility increase. So the subsidy may not make really any difference when you can charge them up to 5 times more. And that's according to Swarecki 2017, that the ratio and the subsidies or tax credit doesn't really add up. So they're still penalizing them for chronic pre-existing conditions, basically, that most people who age in America have. So I don't support that component of the American Health Care Act. The 3-to-1 was bad enough. I think 5-to-1 is extremely high. So those are the components that I support and do not support according to the Kaiser Family Foundation in comparison to the Affordable Care Act and the American Health Care Act. Thank you.